On the Health Watch for you this evening, if you've ever hurt your back or had joint pain in your hips or your knees, you know how difficult it can be to get relief. Well, there's a school of thought that we all have the ability to heal ourselves through very specific exercises. So in tonight's Health Watch, a look at how the McKenzie method works.
Harry Dornbush of Aventura is very active. He's a marathon runner and an avid golfer. But a recent episode with his back stopped him in his tracks.
Leaned down to pick up, to untie the shoes, the running shoes, and that's where it happened. I felt it. I felt like a squeeze.
He learned he had a herniated disc and would probably need surgery.
Initially, remember, you started with a lateral shift.
But he went a different route, choosing to heal himself through exercise with something called the McKenzie method.
The goal is to teach the patient to treat themselves as well as to prevent reoccurrence. Go ahead, lie flat again.
Dr. Yoav Suprun is a physical therapist at Canyon Ranch on Miami Beach and practices the McKenzie method, which began back in the 60s.
Extension in lying. The majority of patients that feel lower back pain, like Mr. Dornbush, comes from a mechanical disturbance in the resting position of their spine, and often they can fix it on their own with coaching by me or by any other McKenzie physical therapist.
Dr. Suprun says the key to success with this method is to move pain from the hips, legs, or arms to the middle of the back, a concept known as centralization.
A lot of the time when patients start to feel lower back pain, they actually experience disc bulging. As soon as it continues to bulge out, it puts more pressure on the nerve roots. The further it squeezes on the nerve root, the further down the leg we start to feel the pain.
Once the pain moves to the back, patients can perform certain exercises every hour to help improve range of motion and strengthen the back.
If the patient learns to recede this back in, which is what I taught Mr. Dornbush, the pain should come out of the leg back into the back.
It worked for Dornbush, who avoided surgery and now knows how to heal himself.
I would say after 3 weeks or a month, I was able to go back to almost my normal activities.
Pressure on, pressure off.
For me, it's kind of a miracle.
And this method may not work on the more severe problems. That's why having a thorough evaluation is critical for the correct diagnosis and treatment plan.